Communicable Disease Branch of Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. Dr. Zhang will first give you an update of today's cases. Good afternoon. 33 cases tested positive as of last night. Case numbers 12805 to 12837. 30 cases involved the variant strain N501Y and T478K. 3 cases are still pending. 28 cases are imported cases. 2 of them involve cargo flight crew members, one arriving from Russia, the other from the United States. Both cases have been identified at the airport. There are also 11 cases involving foreign domestic helpers arriving in Hong Kong from the Philippines. On the 4th of January, 5 of them arrived in Hong Kong via flight CX932. These cases are identified at the airport. 6 cases took Z21264 on the 2nd of January, and they provided the specimen on the 3rd day, and some of them tested positive in the quarantine center, some in hotel. And 5 other cases arrived in Hong Kong via RA409 on the 4th of January. These cases are identified at the airport, and there are also another 5 cases arriving in Hong Kong from India on the 2nd of January via flight AZ1314. There is also another case arriving from Australia on the 2nd of January. The other flying from Portugal to Holland via South Korea by flight CX419. The specimen was provided on the 2nd of January, and there is also another case coming via flight TG638 on the 31st of December. The other case arriving from Canada AC007 on the 2nd of January, and also another case involving a 3rd specimen testing positive coming via KC600 on the 2nd of January. There is also another confirmed case related to an important case. Some cases were referred to yesterday. The Indonesian helper is now a confirmed case. The case number is 12806. The other case is 12806, residing in Causeway Tower, who danced with other confirmed cases earlier. She was sent to hospital because of presence of symptoms. 12821 is a 59-year-old female living in Serene Court, together with another confirmed case, 12754. She had a meal at Six Garden Restaurant in Tin Hau, and that's case number 12821. There is also another case, a 62-year-old female who patronized Moon Palace Restaurant living in Rockview Gardens. The case number is 12822. The other case involves a male, the wife of whom is a close contact to 12754. The wife is now a confirmed case. The husband's case number is 12825. The wife right now is not assigned any case number. The preliminary positive case had a meal with 12754 at the Six Garden Restaurant. So altogether, at the Six Garden Restaurant, 12754 had a meal on the 31st of December together with 2 of her friends, 12821 and 12825's wife. The daughter of 12821 is also another preliminary positive case. 12767, the surveyor who resides in Tuen Mun, also had a meal at the same time at the Six Garden Restaurant. He had breakfast there during the same period of time. We conducted a site visit at Six Garden Restaurant last night. from 8:10 to about 10 o'clock, there were about 20 customers. It's just an estimate, as no accurate figure has been provided. For the 5 confirmed cases and other patrons that have been sent to the quarantine center by way of looking up the octopus card information, we still have 10 customers not yet identified. So I'm appealing to the public that for those who had breakfast on the 31st of December at the specified time at Six Garden Restaurant, please get tested and please contact us. At the moment, we're unable to contact around 10 customers. In order to cut any transmission link that may be present in the community, we're going to issue another compulsory testing notice against these customers. And these relevant individuals will be required to be tested by tomorrow. And once the tests are completed, they should notify the Center for Health Protection. I appeal to the public that for those who had breakfast at Six Garden Restaurant between 8 and 10 a.m. on the 31st of December, please contact the Center for Health Protection at number 21251111 and 21251122 to protect yourself, your family, and the public. And they are also required to abide by the requirements under the compulsory testing notices. We're going to specify that these individuals will be required under the CTN to notify the Center for Health Protection their testing results so as to meet the requirements in the notices. And we will staunchly follow up on non-compliance cases, including the issuance of tickets and initiation of prosecution. Apart from cases relating to the Six Garden Restaurant, we also have a number of preliminary positive cases. 12805 went to a church on the 1st and the 2nd, and in conducting contact tracing, we've identified another preliminary positive case. This person lives in Mason Mansion in Tai Po Market in Tai Po. She is an Indonesian helper and she lives with her employer. The household contains 3 members. She already received 2 BioNTech jabs. Her activities mostly involved going to the church in the afternoon of the 30th, or rather, in the evening of the 31st of December. She took transport 70. That's bus number 72X to Mongkok, and then she took bus 102 to the church where the other confirmed case also went to. She had some activities there at the church, and in the evening, in fact, she spent the night there together with 5 other individuals in 2 rooms. So she stayed overnight, and then the following morning she went to Kongji Wonderland with 2 other friends. She then went back to the church and then had other activities with her mask on, including singing and dancing. She then went to another Thai restaurant called Thai Cuisine at about 4 in the afternoon with some friends, and she returned to the church afterwards. That evening, together with 4 friends of hers, she spent another night at the church, and then between 10 in the morning and 1 in the afternoon on the 2nd of January, she had a meal with 3 other friends in Victoria Park. In the afternoon, she returned to the church. And she, during that time, met with 12805, the other foreign domestic helper we referred to earlier, they were wearing masks, but they had a chat for about an hour and they also hugged each other. In the evening, she had another meal with others in the church before going home. We extrapolated that infection probably occurred during this time. About 2 to 2:30 p.m. on the 3rd of January, she went to the market in Taiyuan Estate, and then she stayed home and had a meal with the household. At about 2 to 2:30 p.m. on the 5th of January, again, she went to the market in Taiyuan Estate, and she also went to get tested at the sports center in Taiwo Estate. And that she tested preliminary positive by the time we contacted her, and we therefore sent her to the quarantine center. That's one case.
And also, there are some other cases worth mentioning. We have a preliminary case which is a 67-year-old female. She lives in Feng Fai Terrace in Happy Valley, a housewife. She has received 2 Sinovac jabs. Now about her activities. We are still investigating the case. On the 1st of January, that's a Saturday, at a restaurant called Fu Hin, she had a meal gathering with 15 friends from a dancing group at 2 tables. That's the Wealthy Garden restaurant. We are still tracing the close contacts of the patient. After the meal, she went to the Wong Nai Chung wet market. She went to the children's hospital as well. She visited her grandchild with a glass panel in between, and then she went to the Outback Steakhouse in Causeway Bay to have a meal with family members. And on the 2nd of January, she went to Hangang Day in Causeway Bay via public transport. On the 3rd of January, she went to Yubo Hin with 3 family members for a meal. On the 4th of January, she went to the Wong Nai Chung Sport Center between 8 to 9 a.m. to teach a student exercise. And then she went to the Causeway Bay West Market for shopping. At night, between 8 and 9 p.m., she taught 2 students Ba Duan Jin. On the 5th, she went to the Tang Siu Kin Hospital and left a sample. She then went shopping at U Select and Mannings in Happy Valley. She was tested preliminary positive and has been sent to hospital. We are still tracing her friends in the dancing group to find possible links between them. Another patient, also a retiree, a 73-year-old lady. On the 6th of January, she developed a headache. She lives in Block 3, City Garden in North Point. She is a close contact of another patient. On the 31st of December, she went to the Causeway Bay Community Center with case 12754. She danced with the patient, so she's considered a close contact. She and her family members have been sent to quarantine center. That's the 4th of January. Her sample On the 5th, tested preliminary positive, and she felt unwell on the 6th. So now she is already hospitalized. Besides going to the community center in Causeway Bay for dancing on that night, she went to Tai Gam Hang restaurant to have lunch on the 1st of January at the Fairwood in Fortress Hill. She also had a meal. On the 2nd, she went to the Causeway Bay Disciplinary Services Center to dance, and then she went to have meal at Sei Guai Hin at night. On another day, she went to a foot massage parlor, Chuk Fuk Lei, and then on the 4th, she was sent to the quarantine center. Another patient is a 63-year-old male. On the 30th of December, at Windsor House
13/11號嘅皇室堡嗰間啦。
East Ocean Lafayette, he had lunch. That's in Causeway Bay. His lunch coincide with the time when case 12754 had lunch. We are conducting a site inspection as we speak. It seems that the two tables were located quite near apart, and we think there may be a possible infection, possible transmission at the restaurant. Besides the lunch on the 31st of December, this patient also goes to have morning exercise. On the 31st of December, on the morning, on every Wednesday and Friday, he would do exercise in the morning and then go to have breakfast at McDonald's. And at night, he went to Yau Ma Tei, a Ho Choi restaurant, to have a meal. He mostly exercises in the playground behind the Central Library at Tin Hau, usually by Ba Duan Jin, between the that's between 7 and 8 p.m. In the morning. He also went to Yau Ma Tei Kado Primary School for religious service to go to church, and then he also went to have steak in Yau Ma Tei. On the 3rd of January, he had a sore throat and coughing. On the 4th, he went to a University of Hong Kong clinic to seek medical help, and then he went to Zhenji Gun for a meal. He left a sample and was tested preliminary positive. He submitted the sample and was tested preliminary positive. Now we are conducting an inspection at East Ocean Lafayette. We urge those who have been to the Lafayette between 8:30 a.m. to 10, or rather 9:30 a.m. and 10:30 a.m. on the 30th, to reach out to us. We are gathering data about the customers, and we will send compulsory testing notice to these customers.
OK，我今日嘅報告係咁多。
That concludes my report, and so far we have over 30 preliminary positive cases. Dr. Ho will have the floor and she'll report on the HA situation. Good afternoon. As of 9 a.m. this morning, the HA system altogether reported 32 cases. In terms of SARS-CoV-2, positive testing results, 5 patients were recovered and were discharged, and so far we have 1,235 patients discharged from hospital. At the moment, we have 335 patients staying at the North Lantau Hospital, Hong Kong Infection Control Center, and Asia World Expo Community Treatment Center. 1 patient is in serious condition. 314 patients are in stable condition. We have 1,107 negative pressure beds with a utilization rate of 58%. We have 611 negative pressure wards, and 66% of them are used. The floor is now open for questions. Please introduce the media organization you represent. Any questions? Over here. Good afternoon. I'm Dim Sum News. As there are more cases involving parents of kindergarten pupils and primary school students are involved, there are questions whether all classes should be suspended. What will be the indicator the government uses in deciding whether to suspend all classes? Another question, there are calls that the Leave Home Safe app should introduce a real name registration system so that we can better track down close contacts. Otherwise, what should be the method used in your tracing effort? As for whether all schools should be suspended, I think the government will consider various factors. Public health and disease prevention are some of the factors for consideration. As for whether the Leave Home Safe app should be enhanced with more tracing functions, I think this is also something we will consider. Another question. This lady at the back on the right-hand side. Dr. Zhang, I'm from Commercial Radio. First of all, about preliminary positive cases, are there or is there any Legislative Council member? Because we heard through the grapevine that some LegCo members had a gathering with a preliminary positive case. And also Casper Choi, the Secretary for Home Affairs, did he also attend the same event as the preliminary positive case? Another question. How many beds in Penny's Bay Quarantine Center have been used so far? And will its capacity be reached? And will the next step be home quarantine? I'm not sure about individual cases, but according to our preliminary cases at hand, we do not have any Legislative Council member. As for the Penny's Bay Quarantine Center, we keep close watch of the number of beds available, and we also have backup plans. If necessary, they will be kick-started. Another question, this lady in front. Good afternoon, I'm from Hong Kong 01. 12821, that's the daughter of 12821. Is it that no case number has been assigned? And may I know the background of this case? Is it related to Pui Kyu Middle School in North Point? Another question. The flight attendant mothers cluster is now growing, and yet it's still regarded as import-related cases. But we have seen a third-generation transmission. Now we have cases relating to 12805. Is it the fourth-generation transmission? And when will you regard it as a local case? 12821. Her daughter is a family member living together, and we issued a press release. She works in the Wing Yun Tea House because she is regarded as a household close contact. She's been identified, and she's now a confirmed case. Sorry, what was your question? No case number assigned? That's true. for cases related to an imported case, it all depends on whether we could trace the source of infection. If we are able to identify the source, we'll try to see if there is any linkage with an imported case. However, the majority of cases we have recently identified are local cases, meaning that these cases have been infected locally. It's just a matter of whether we're able to trace the source. The difference is that if we're able to identify the source, we'll be able to at least identify the chain of transmission and the trend, and that will be able to curb the transmission. If we're unable to identify the source, however, then it may be the case that we are unsure how many people in our population have been infected, and that infection continues to take place. The other question, please. I'm from Cable News. We've heard news. News that Mr. Casper Choi will have to be quarantined. Is that true? And for the case living in Happy Valley who went to East Ocean Lavayette, is it that these are untraceable cases? And how many people had the meal together? And that we heard that some LegCo members had contact with a preliminary positive case. How do you assess the risk? Would you require all LegCo members to be tested, or would there be other measures? I have not received information about any preliminary positive case involving a LegCo member. In fact, we have been tracing a lot of close contacts, so I'm afraid I don't have further information to provide. For East Ocean Lavayette, our preliminary view is that it is possible, and in fact likely, that they're linked, because 12754 also had a meal nearby. In fact, many of these cases visited a number of restaurants all over Hong Kong, and we have been identifying transmission links in these restaurants. So our preliminary information suggests that their tables were quite close to each other. We can't rule out the transmission that could take place in the restaurant. So this preliminary positive case could be related to an imported case. And that is the subsequent transmission that took place in the restaurant. About the case in a dancing cluster, we're still verifying the information. We are checking who else had a meal with her. She might not remember the names of everybody around the table with her. Our preliminary view is that she might be connected to some previous cases. At least they were acquaintances, but we're in the process of verifying the times and places which they met.
HK. So there are more cases of domestic helpers being infected. Are you worried about an outbreak among Indonesian helpers? And also, do you expect more cases will emerge from the Six Garden restaurant cluster as the ventilation there was poor? What will officials do to track down the remaining 10 customers? And about the preliminary cases, there are a number of them involving elderly who live on Hong Kong Island. Are you worried that there will be an outbreak among elderly people there? Thank you.
Yeah, indeed, the situation is a bit worrying. And every day we are receiving some preliminary positive cases, although some of them, or at least up to now, they seem to be linked to the previous cases. But we are seeing transmission among church attenders, among those who attend the same restaurants or in the dancing class. So we expect there will be, we cannot exclude the possibility there will be more cases coming out. And For the foreign domestic helpers, we are tracing those churchgoers on the first and the second of that church. That amounts to tens of peoples. So we are a bit worrying because they may already have spread the infection to their employers or other friends. So we are actively tracing them and put them under quarantine. We have some difficulty in tracing the Lok Tin Yuen restaurant because for some they have the Octopus card, but some of the cards are not personalized. For those personalized Octopus card, the records, the phone numbers, some of them cannot be reached. So we appeal to all those customers who went to this restaurant in that morning to get tests and phone us as soon as possible for the sake of their health, their families, and for the community. And for the elderly and those who had done morning exercise in the near the, in the confirmed cases or preliminary positive cases, they have quite some activities, gatherings together for exercise as well. For some of them, they have meals together. So these are the occasions that the infection may get spread. That's why we are a bit worried. We looked at that some of the confirmed cases, they are not vaccinated. So we appeal to the public, especially those who are elderly, to get vaccinated as soon as possible.
下一題仲有冇英文問題？嗰邊。
Next question, any English question?
In from the South China Morning Post, Dr. Chuang, can you give us an update on just like the cruise and whether there have been any cases detected so far? And I'd like to clarify actually among the preliminary positive cases you listed today, how many are classified as untraceable so far? And do you have an update on there have been reports that there's a preliminary positive case involving the mother of a student who attends a school in North Point, the Puikil Middle School. Do we have information on that? Thank you.
For the cruise, we have did a test on all the cruise, the people on the cruise, including those crews, last night, and tests have been done on 3,766 persons, and they are all negative. And we have put the 9 close contacts as well as 3 household contacts of close contacts who are on in the ship, and also 18 close contacts who are unknown to them but identified through the app in the spectrum of the sea. They have been put under quarantine for testing. And for the preliminary positive cases, so far, the case in the Happy Valley, the case, we are still tracing the exact epidemiological link to the other cases. But from the preliminary information, we understand she knew some of the confirmed cases. But we need to clarify at what time they met and during what incidents. So preliminary that we have not classified untraceable cases so far. I believe it's case 12806. Yeah, actually for all those household contacts of confirmed cases, household contact of confirmed cases, if they are attending schools, we will ask the school to suspend for a few days until the attendee of the school tested negative. Yeah.
下一題，前邊嗰位。
Next question, the gentleman in the front. I'm from AM 730. Has the classification of the surveyor been changed to related or linked? And among the 4 preliminary cases, how many of them are untraceable? The Happy Valley patient, when did she have an onset and why was she tested? East Ocean Lafayette, how many customers were there? What about the table numbers of the 2 tables? How near were they? Later on, will Professor Yun inspect the restaurant? Any confirmed case or preliminary positive cases have attended a gathering of more than 100, so that more than 100 people have to be quarantined. The Happy Valley case, she has no symptoms. She went to get a test. It's probably because she had meal with her friends at Wealthy Garden on the 1st of January. That's why she went to get a test. So we think she is related to previous confirmed cases or close contacts. She mentioned some names. However, after checking, it seems that the persons did not go to the restaurant, but they do know each other, so we are cross-checking. At this moment, she is just a preliminary positive case. We haven't classified her as an untraceable case yet. It is very likely that we will be able to find a linkage. East Ocean Lafayette, our colleagues are conducting an inspection as we speak with EMSD colleagues. Cases have surfaced and we would carry out site inspection immediately. The over 100 gathering, there were some. For example, the Indonesian domestic helper, when she had dinner, there were 80 to 100 according to her. We also had another case I can't go into the details of each of the cases, but we did have some cases attending big gathering. It depends on the length of the gathering, whether masks were put on, whether it was a meal gathering. If that's the case, there would be chatting with mask off. We did have these cases, and the entire group would be sent to quarantine center. Sometimes we have people staying only for a brief period with mask on, and then they may not be quarantined. They're not very sure about the table number, just the rough location. We are checking it together with the staff as the restaurant. We are still checking.
Next question. This gentleman. I have a question. Which media organization, please? Ming Pao. The question is this. The other reporter mentioned large-scale gatherings. Was there any gathering of such nature that took place on the 3rd of January? And for cases requiring quarantine, does any case involve a government official or somebody in the Legislative Council? And according to the existing guidelines, is it that for such major events, government officials, public officers should avoid attending them? And I have a question about other cases. First, about the flight attendant 12676 and 12754, that is the flight attendant and her mother. May I know the CT values of these cases? About the employer of the foreign domestic helper, the foreign domestic helper whose case has just been confirmed. May I know how serious her condition is, and whether she's been vaccinated? And for those on the cruise ship, how do you assess the risk of passengers and crew on the cruise ship? And according to your assessment, what is the level of risk of transmission on the cruise ship by the foreign domestic helper and the employer? As I understand, for the gathering on the 3rd of January, it involves the case who's a 37-year-old living in Serene Court, and this case went to a Spanish restaurant in Wan Ging Center in Wan Chai. We have yet to get hold of other information, including the number of people involved. So we have to inquire further. For example, when the activity took place, did the case wear a mask, and how long did the case stay, in order to decide the number of close contacts? Let me check the other case. Let me check this case for its CT value. I don't quite recall. I'll give you this information later in the interest of time. For the employer, at the moment, the employer is not a preliminary positive case. For the 9 close contacts on the cruise ship, one is the employer, the other is a family member of the employer, and they all took part in the dancing activity. So there were 2 of them, and once we learned that they boarded the cruise ship, we immediately asked the operator to hold the trip and conduct tests. And another test was conducted yesterday at Penny's Bay. The result was negative for 2 reasons. Either they did not get infected, or that it is still within the incubation period. The source of infection is the foreign domestic helper. This helper sometimes would go to the Victoria Park to help bring items to her employer, drinks, so on and so forth. So perhaps they did meet in person instead of getting infected via the employer. So far, at this stage, we haven't identified any positive case on the cruise ship, but of course, the risk of having an outbreak on the cruise ship would come down as time goes by, and we're keeping close watch on the matter. We've asked the crew of the cruise ship to get tested tomorrow again. Those who boarded this cruise ship will be subject to a compulsory testing notice for testing tomorrow. The speaker's not coming through. I haven't noticed, but I can't rule that out. This lady in the middle. I'm from Now TV. About the 37-year-old daughter who went to Wan Ging Center in Wan Chai. What did she do, and how long did she stay? And for the other case, she danced at Police Officers Club in Causeway Bay. Is her family member a member of the police force, and how many family members are involved? And the flight attendant had the onset on the 29th of December, and now we already have a fourth generation transmission. What is the assessment made by the Center for Health Protection? As I said, we're still inquiring about her activity at Causeway Center, and I believe that the chief executive will be holding a press conference very soon, and there will be more information by then. For the 73-year-old female, I don't have information whether she's a retiree and whether she's connected to the civil service. She danced at the Police Officers Club in Causeway Bay, and we need to make further inquiries. Next question. This reporter in grey. Dr. Zhang, I'm from TVB. You mentioned just now that as long as you're able to trace the source of infection as an imported case, you can say that it is connected to an imported case. So how many transmission chains there are in the community? Now, many of these cases are concentrated in Causeway Bay and Victoria Park. Is there any chance you can get environmental samples from the park to curb infection among the foreign domestic helpers? And Professor Yuen Kwok Yung also commented that very often infection takes place when one takes off a mask. So will you tighten the requirement such that even when you are exercising, you're not allowed to take off your mask? For transmission chains, the identifiable ones are, first of all, the Moon Palace restaurant. Many people could be involved, so we're unsure whether that's the end of the chain. The other chain is related to this case, 12676's family member. For example, we have just identified cases not belonging to the dancing cluster who are unrelated to this case but who had meals at the East Ocean Lafayette. And a case went to the home of the Indonesian helper, and it seems there's a transmission chain at the church, and the other chain exists at Six Garden Restaurant for patrons sitting at different tables, and there is also transmission which has taken place at the Causeway Bay Community Center. For the case who had a meal at Wealthy Garden, we need to conduct further investigation into this possible chain. So I would say that it's really complex, involving many people. For example, the Indonesian helpers case, over 100 people may be involved. So it presents a major challenge to us in tracing down close contacts. As for restaurants and other places, I hope that members of the public would comply with the compulsory testing notices so that we can identify possible transmissions. We haven't taken any environmental samples from the Victoria Park because, after all, it's an outdoor environment and it would be quite impossible to take samples. And, of course, wearing a mask is a good precautionary measure against infection, in particular in an indoor environment. Of course, if you wear a mask or if you stay outdoors, if you keep a distance, the chance of infection is lower. And I think this is for the government to decide or to consider. Next one. Oriental Daily, good afternoon. For the foreign domestic helper who attended a number of large gatherings, she went to the church and went to the park. Is it necessary to require all foreign domestic helpers to get tested? Could the capacity cover all foreign domestic helpers? Would that be measures to ban foreign domestic helpers from coming. And you mentioned that for the transmission chain sparked by the flight attendant, it is getting complicated and it is a major challenge. Would it be possible that in the coming 2 weeks there will be a further tightening of the disease control measures, including the dine-in ban at dinner time, and about the possible transmission at the Pui Kyu Middle School? Although at the moment it is not a confirmed case, will there be arrangement for close contacts or fellow students of the same class to be sent to the quarantine center?
都係
About the domestic helper, we are quite worried about the situation. We do not rule out any possible measures when more and more domestic helpers get infected, causing a spread of the virus in the community. We do not rule out any measures to cut off the transmission chain. The coming 1 or 2 days or 1 or 2 weeks are very crucial. We will see whether the infection chains would be curbed because of our measures. And also depends on whether the case come from our testing or approaches us on their own. Family members of close contacts are also close contacts. Places visited by close contacts, including schools and kindergartens, would be required to suspend and carry out a thorough sanitization pending the testing results of the close contact. We would not require everyone to be tested at this moment. Household members of close contacts will be sent to quarantine. However, if it is just activities with mask on, we will not require the person to be quarantined. The last question, Hong Kong Economic Times. The preliminary positive Indonesian domestic helper who went to a church, what's her age? And is there an outbreak within the church? What about close contacts of the domestic helper? How many people are there? About the surveyor, have we ruled out the possibility that he was infected while walking past Victoria Park, 20 meters away from the patient? And the 37-year-old female, she went to a Spanish restaurant. Did she use the LeapHome Safe app? Because you didn't tell us when she left the restaurant. The 62-year-old female, she was quarantined on the 4th of January, but there was an outbreak from Moon Palace on the 29th of December. Why was she quarantined so late? Thank you. About Moon Palace, it depends on whether the information of the customers was available. If all 207 customers' phone numbers were available, then we can quarantine them immediately. However, we had to find the credit card companies for their phone number, and then we could not reach some of the customers. That's why there was some delay. About the foreign domestic helper, that's a female. I don't see her age here. I don't have her age right now. What's the other question? You mean the new case involving the foreign domestic helper? Like the other domestic helper, her close contacts are mostly fellow churchgoers. We are still checking. She was there for 2 consecutive days. Some people might not have been there for both days. On both days, some friends ate with her, but of course, her employer would be her close contact. There are some overlapping among the close contacts. Comparing the two cases, in the restaurants, the patients did not wear masks. They were seated close together. So the infection risk would normally be higher than in an outdoor setting. At the time, we only knew that they ate in the Six Garden restaurant, but we also knew they were both present in Victoria Park. That's why we were worried. Now we consider the possibility higher in the restaurant. There is a risk of infection outbreak in the church. The infection has already started. It still yet to be seen. That's the end of the media briefing. Just a moment. The CE will give you more details.